Hey everyone, it's Tremia, and I'm back. It's amazing how time flies, especially when you're not feeling well. I know I had promised that I was gonna, keep up on my vlogs and, not have them so far spaced apart. And I just look and to me, it doesn't seem like it's been that long since I had done a vlog, but the dates on the vlog tell it all. And it's just been a long, hard period of going through some sickness and illness. And it's more than just lupus. And I've been really, really ill, really sick, and just not faring too well. My last vlog was on the leiomyoma and about the tumor in my back, the mass, and that, the original biopsy came back as benign, and then my oncologist sent me to he's a orthopedic oncologist surgeon that specializes in the specific tumor, and he wanted to start over from square one, so he knew what he was dealing with. And we still do not have an answer. And the stress of that is wearing me down and not making matters any better. And they've looked at the slides. They've sent the slides all over the United States. The slides are back here in Oklahoma. They ordered the block, which is the complete specimen. Still no answer. But I do know that my surgery is going to be January 9th. And he will take out the tumor while I'm still in surgery. He is going to go downstairs to pathology himself and look at the tumor, make decisions. At that time, we are hoping for a diagnosis before then. They're bouncing back between whether it's benign or malignant. They're just kind of stuck in the middle. There's questions. There's things about this tumor that's normally not associated to it. If I understand right, there's some cells in there that normally are not found in this tumor. This type of tumor is rare. Where it's at on me is even more rare. And then these things are just unheard of, and I guess they're trying to figure out how to handle it. His nurse practitioner spoke to me in length, and she spoke to me as if it was malignant, and went along the lines that they will take out the tumor. They'll have to take out margins, meaning they'll start taking out the tissue around it, which is muscle, until they get to completely clear margins, meaning that there's no malignant cells or weird cells in it. But he did tell Dwayne that even if he did have to take out wide margins, that I would not be disfigured, that there would not be a sunken in spot on me, that the only thing that you'll see is the incision on my back. So that makes me feel better, because I was afraid it was going to be, just a really sunken in spot, and he said it's not going to be like that at all. And so they'll take out the margins, and, it'll be a tough recuperation since it's surgery on the muscle. And then they would finish it up with chemotherapy and radiation, and I don't know what types those would be or anything. I just know that that's what they would go with. And with that, they'll send me back to my oncologist who does my IVIG and everything. So I would have all of the treatments where I get my infusions at, where I know everybody at and everything. So that would bring comfort to me, because I know they take good care of me. So with that being said, the mass in my back, it's growing. Because initially when it was diagnosed, you couldn't feel it, couldn't see it, I couldn't palpate it, hard as I try to feel it, I couldn't. But now, I can, and it's causing more severe spasms and more severe pain. And he said he can't guarantee that it'll take it all away 100%. But I know that it will take it away a great deal, because the spasms are directly where that is, and the wraparound pain is directly where that is. So January 9th is going to be the, oops, sorry, I don't know how long my finger was in the way. January 9th is going to be the big day. And what else? On January 5th, where I've had the rhizotomies in my back, where they go in and kind of burn the nerve endings to keep the burning pain, because I have this horrible burning pain in certain areas, and the pain pump doesn't handle the burning pain. On January 5th, my pain management doctor referred us to another doctor that does rhizotomies and, injections and that kind of stuff. On the 5th, I'm going to go in for the pre-trial. He has to start over from square one too. They're going to do injections in my back, numbing injections, and see if that works. And if it does, once it wears off, they can go in and do the rhizotomies. And that's all, oops, sorry. That's also near, the surgery and everything. So, my back's going to be getting a lot of work done on it the first part of the year. Plus, I hate it because, got to meet new deductible is January 1st. I'm going to meet it in the first few days. Cha-ching, cha-ching, cha-ching. And that is where we are on the back, and just trying to get the pain under control. The pain pump, it is doing its job. Unfortunately, I just had some circumstances that come up that, have kind of put us at a standstill. It's like the pain has increased instead of decreased due to due to the mass, and due to the rhizotomies wearing off and stuff. But I know once all that's under control, that pain pump is going to be gold, because as far as the pain in my arms and in my legs, it's lessened, but I still got a lot of pain. And I've gone from living at a 9-10 each day to right now, I had gotten down to a 7, but it's creeping back up because of everything. And I'm at an 8, and if we have to go to the doctors, it goes to a 9 really easily. But he adjusted my pain pump up to where the medication is, I'm getting more of it, so I'm getting a higher dose. And also the boluses that I can give myself, he gave me from 4 to 8, because I started having some chest pains and heart problems. And that's what I'm going to tell you about in the next vlog. And I promise I don't want it to be 3 to 4 weeks away. I'll do my best, because I want to keep you guys informed, and I want to teach, and I want people to know about lupus. And right now, this is probably, other than being in the hospital and not remembering that on a day-to-day basis at home, this is the worst I've ever been. And it's a struggle. It's a struggle. Well, it's time for me to go, so I'll see you guys in the next video.